the dreams of children, of Philadelphia's children, to be happy, to be loved, to be healthy, to have hope. But not all of Philadelphia's children can attain those dreams unless quality health care is available and affordable in their communities. Temple University Hospital has provided superior clinical care, health education, and medical research for over 100 years. For example, when people dream of a solution to heart problems, they frequently turn to Temple University Hospital, which is #1 for adult heart transplants in the country. When professional athletes or weekend warriors dream of getting back into the game, Temple Sports Medicine has a national reputation for winning results. And when life's accidents and misfortunes provide a rude awakening, people know they can always turn to Temple University Hospital's leading trauma center for life-saving treatment. But with all this and more, there is one dream that remains unfulfilled. It's for the children. That dream is Temple University Children's Hospital, the creation of a new hospital dedicated to providing superior health care to those who are so vulnerable.
It is time for the children. In the community served by Temple University Hospital, there are so many more who must be helped. We still have an overwhelming need for increased medical care, both inpatient and outpatient, and in the community, all for that which is most precious to us, our children. For example, of all the infants born in the immediate area, about 30% are born here at Temple University Hospital. Over 60% of the babies born here result from high-risk pregnancies with low birth weight or other significant disorders. Until now, we've had to transfer many of them to medical facilities away from their homes and away from here because we just didn't have the capacity to care for them, even with programs like Dr. Reese's Model Infant Mortality Reduction Program.
That is correct. With a facility devoted to pediatric health care, we certainly can improve the success of these programs, starting with education for the expected mother and enhanced prenatal and preventive care. It will be much easier for families to be together during these times.
But the dream is not only for today's children. Future generations will benefit as well, because the development of the Temple University Children's Hospital will enable us to improve and to carry out our research and educational mission embodied by Temple's philosophy, that one should give back what has been given to you. Dr. Joseph Kabaki, professor and chair of pediatric and adult ophthalmology, has devoted his career to improving the quality of medical education at Temple.
The addition of pediatric care to the Temple University health system will benefit medical students tremendously. The new hospital will broaden the base of patients whom students can care for and observe on a regular basis. It will enable students to conduct research on pediatric diseases and explore how those diseases develop over a lifetime. The new Children's Hospital will also provide Temple medical educators and students with a permanent research and clinical facility.
Yes, we have a dream of a new children's hospital that will make Temple University Health System the most complete in the city of Philadelphia. It will be a technologically advanced facility that will serve as the center for pediatric care. And using the hospital without walls concept, it will be the source for outpatient treatment and preventive healthcare education and information that will reach out beyond our walls, right into the homes of our children. For over 100 years, Temple University Hospital has used its pediatric expertise to improve children's lives. But with a dedicated children's hospital, we can do so much more. For example, Temple University gave Danny a chance to play baseball again. Without Temple, Samuel would have a far more limited quality of life. And Billy would never be able to run and play with his friends. Temple University Children's Hospital is vitally important to these and to thousands of other children. Here are some of their experiences.
Born with a congenital heart defect, at the age of 13, our son Danny needed a specialized procedure. We brought him to other local medical institutions, and they couldn't help him. We turned to Temple and to Dr. Miller for an evaluation. Compared with other hospitals, it was remarkable how much time Dr. Miller spent with us. Even his surgical report showed his personal touch and commitment to our son. He cared. No other local children's hospital had the technology or expertise to do the procedure which Dr. Miller performed. The surgery was a success, and now Danny is back playing baseball. This top-quality care should be available to all children.
Without Temple, who knows what sort of life my son Samuel might have had. He was born with Down syndrome. At the age of 1, I brought him to Dr. Kubaki at Temple University Hospital for treatment of esotropia, or crossed eyes, which can be a common problem with his condition. Through surgery, Dr. Kubaki corrected this problem to enable Samuel to function well visually. Samuel will need care and supervision throughout his childhood and into adulthood. But like my son, children with multiple problems will be able to be seen in one place, Temple University Children's Hospital, by a team of doctors who are familiar with their histories.
Without Temple, Billy might have lived a life with a serious mobility challenge. Born with a club foot, Billy might never have walked or run properly. Fortunately, shortly after his birth, we were referred to Dr. Philip Allberger, an orthopedic surgeon at Temple. Dr. Allberger will monitor Billy's foot through childhood and adolescence until his bones stop growing, and Billy should be just fine.
Danny, Billy, and Samuel were lucky. Their problems were noticed, and they were seen by a Temple specialist immediately.
But not all children will be so lucky unless we can fulfill this dream. The dream is of the new Temple University Children's Hospital. It's well on its way toward becoming a reality. It will completely fill the block on North Broad Street between Tioga and Venango Streets. The beautiful new 10-story building will be connected by a large atrium to the Shriners Hospital for Children, which is moving to the Temple University Health Sciences Center campus. Both Temple University Children's Hospital and the Shriners Hospital for Children will be connected to Temple University Hospital by a skywalk over Tioga Street. In this building, there will be over 50 physicians' offices. The total complex will be a comprehensive, state-of-the-art healthcare facility beyond compare. The result will be greatly improved facilities and equipment with lower costs for Temple University Children's Hospital, the Shriners Hospital for Children, and Temple University Hospital. All will share certain services such as physical rehabilitation, pharmacy, laboratory, diagnostic imaging, and much more. Temple University Children's Hospital will be the most cost-effective children's hospital in the Commonwealth of Pennsylvania. Now is the time to turn the dream into reality, but we can't do it without you. We need your help in our $25 million campaign. Please help us turn the dream of a state-of-the-art surgical suite for infants into a reality. Please help us turn the dream of giving hope to children with life-threatening diseases. And please help us turn the dream of building a new hospital, one that will be a friendlier place for kids, into a reality. Together, we'll be able to do so much more for so many more children.
Temple University Children's Hospital. Healthier todays, brighter tomorrows.